My name is Pauline Jervis. I'm one of the assistant senior managers and I work for Surrey County Council Adult Social Care. My role really is around joint commissioning with health and social care. I guess it's part of a wider initiative really. We are funding Surrey-wide a telehealth programme. It's funded through what we call our Better Care Fund, which is joint sort of health and social care funding. We're working with all of our clinical commissioning groups and also all of our providers, including Surrey and Borders, on development of a wide-scale telehealth programme. And I guess the drivers behind it were the things that you'd expect really. So ever-increasing demand, particularly with a ageing population and their associated risk of long-term conditions and complex needs, against a backdrop, I suppose, of sort of strained resources. Our provider services are all working to maximum capacity, and we needed to find a way really of managing people in a sustainable way, being able to provide them with high quality care, but working within a sort of limited budget. Telehealth seemed to offer an opportunity to do that. Well, I guess the approach that Surrey have taken was this was never really about a project or testing something. It was about, we'd made the decision on wide-scale implementation. We particularly were targeting people in the traditional model with long-term conditions such as heart failure and respiratory disease, but we also wanted to allow some scope for sort of testing more innovative approaches. And we were working with all of the providers. Surrey and Borders partnership approached us with what they saw as a sort of a hotspot, if you like, where there are increasing numbers of people with severe and enduring depression. These people are high users of healthcare and community services, but also emergency services. And there was some research done that they wanted to sort of talk to us about whether we could try something in Surrey, and it was about delivering a sort of a behavioural activation programme through a non-face-to-face mechanism, using telecare to support that, to enable people really to better manage their condition and also to sort of take care of themselves with the hope that going forwards there'd be less need for the intensive support, that they'd learn some techniques, if you like, to better manage their care. There were lots of challenges. I think the key challenges really is a very different way of working. I think the challenges were about, we started really with a blank sheet of paper. We had to develop, although we had a Surrey-wide model, because there are 6 clinical commissioning groups and a number of providers and a number of acute hospitals, we needed to have a sort of a strategy, if you like, that had an overarching direction of travel, but could be locally adapted to suit the pathways and the needs of each of the individual organisations within Surrey. So what we did was we set up individual groups through each of the clinical commissioning groups, led by the local clinicians, GPs, hospital consultants, but also working with our providers very locally, to develop local models of care, local pathways. And we've done exactly the same with Surrey and Borders. One of the local CCGs, or clinical commissioning groups, North West Surrey, is acting as the sponsor. The clinical leads for that commissioning group are also the clinical leads for the project in Surrey and Borders. So we've got a really robust infrastructure to take the work forward. Critical success factors. I think there's a number of them really. I think one of the key things is when you're looking to procure a provider, you need more than somebody that's just going to give you the equipment and give you a ready-made protocol or pathway. In Medvivo, which is our provider of telehealth services, we have a project manager or a program manager. She actually works locally, spends a lot of time with the individual clinical commissioning groups, with the clinicians, with the provider services. And I think that makes a real difference. It's the link between the company that provide it and the actual people on the ground that are going to be using it, that are going to be developing the pathway. So I think that's one of the critical success factors. I think one of the other critical success factors is about having really good, strong clinical leadership. it's not just about equipment. Equipment is a fairly small part of it. It's about the attitudes, the cultural changes, it's about clinical buy-in, it's about provider buy-in, it's about supporting different ways of working and that sort of thing. And I think the other thing is not to underestimate the time it takes. There is the practical things like the writing of local pathways and protocols, but more importantly, I think it's around cultural change. It takes a long time for people to see it, not as an initiative or as a way of working, not as something that's bolted onto their normal way of working, but it just really needs to be embedded in part of day-to-day care, part of a matrix of care to support people with complex needs, and that you see it literally as a tool or part of your everyday working.